This conference will now be recorded.
Hello, welcome back. My name is Victoria, the dietitian you are working with or soon will be working with as part of the Community in Monmouth Medical Center for Bariatrics program, part of Robert Wood Johnson. So supplementing vitamins and minerals is going to be something that will be important to do for the rest of your life after surgery. After your stomach is either partially removed or isolated, you're not going to absorb vitamins and minerals as well as you used to because there's just simply less surface area. In particular, those vitamins that really have been affected is B vitamins and iron, although most all are affected in some way. Also, after bariatric surgery, you just won't be eating enough food to really get all of the vitamins and minerals that you need. So basically, this involves supplementing with a multivitamin and calcium. In the book, there's two ways to go about your supplementation regimen, option 1 or option 2. Option 2 is a little bit more simple because it involves 2 different supplements as opposed to 3, which I will explain why in a little bit. So I'm going to first explain the option 2, how that works, and then go back and explain option 1 as an alternative. So option 2 involves purchasing a bariatric multivitamin, which has a large amount of B vitamins and iron in them, more so than the vitamins that you find over the counter. So if you do a bariatric multivitamin, your regimen will essentially involve 1 multivitamin and calcium split between 2 doses. So it would look something along the lines of a multivitamin in the morning, your first calcium in the afternoon, and your second calcium in the evening. After surgery, for 6 weeks, maybe 4 for some of you, everything needs to be chewable for better absorption of nutrients. Medications usually stay swallowing with pills, but vitamins do need to be chewable. The main thing to remember is that you can no longer take gummy vitamins because they do not absorb well in anybody's body, but particularly the bariatric stomach, which is a lot smaller, will absorb very little nutrients from gummies. However, you can have soft chews, which is like the Tootsie Roll kind of consistency, or you could do a chewable tablet. So in terms of the multivitamin, there's a lot of different bariatric brands that are out there. I have most of these products in my office. I have many samples and coupons, all which I will provide for you when we meet next time. And basically that way you can taste what you like, and pick something before you have the surgery so you don't have to deal with that afterwards. So again, everything needs to be chewable for the first 4 to 6 weeks. And after 6 weeks, you are allowed to switch to capsules, which you can swallow. And I will provide samples of both. Now, the multivitamin, being a bariatric blend, has more B vitamins in it, more iron, and also more vitamin D. So if you were to do option 1, as I mentioned, you would have to add to your multivitamin a B complex and possibly some iron and also possibly some vitamin D. That's why, bariatric brands could be easier and ultimately end up cheaper because you don't have to add all these extras. But again, totally up to you. You're welcome to go to CVS, any pharmacy, and just grab those vitamins over the counter. More details are in the book. Now, the second component of supplementation involves calcium and vitamin D. No matter where you get your vitamin, your multivitamin, and what kind it is, you still need to supplement with calcium separately. This is because calcium will interfere with the iron that's in your multivitamin, and it will also interfere actually with itself because it only absorbs in small doses. So even though you need about 12 to 1500 milligrams of calcium a day, you can't take it all in one dose because half of it will just be metabolized and excreted without actually benefiting your body. That's why the dosages of calciums are separated between at least 2 different dosages a day, sometimes 3, depending on your multivitamin, but we'll stick to 2. And basically, calcium is usually in about 400 to 600 milligram dosages. So you would take 1 in the afternoon and 1 in the evening. As long as they're separated by 2 hours, you can change the times up to be convenient for you. So calcium supplements also contain vitamin D in them automatically. So you do not have to necessarily take it separately. It does also help with calcium absorption, and it's also just needed for your body. If you take a bariatric multivitamin, they will have enough vitamin D that you don't have to take it separately. If you get it over the counter, you may actually have to add a separate separate vitamin D. In general, we are going to check your labs and check for vitamin deficiencies so we can fix those before surgery as opposed to after, because before surgery you have much more of your stomach to use and you can fix the deficiency a lot faster and easier than it will be after surgery. So here is an example of what your vitamin regimen will look like, especially for the first 6 weeks while everything has to be chewable. You have a tablet, which is chewable. You would take this in the morning. It does look pretty big, but it is chewable. It dissolves easily, and a lot of them taste pretty good. And again, I will provide samples so you can see for yourself which brands, flavors you like better. So then we have our first dose of calcium in the afternoon and our second dose of calcium in the evening. So again, that is multivitamin in the morning, calcium number 1 in the afternoon, calcium number 2 in the evening. If you have any questions, we can most certainly discuss those in more details when we meet for our individual sessions. Thank you.